There's a common statement we often hear about cancer. 90% of cancer deaths are caused by metastasis. While this statement isn't always backed by definitive data, today we'll explore what research says about the actual causes of cancer-related deaths. Cancer deaths typically occur due to the failure of multiple bodily systems. Understanding these mechanisms is crucial for improving treatment strategies. In other words, it's not just cancer itself, but various factors associated with it that can lead to death. Acute events is a primary cause. Some types of cancer can be managed like chronic diseases for years. However, death often results from sudden and severe events, which account for nearly half of cancer-related deaths. These events include clotting disorders, respiratory failure, or heart attacks. For instance, a clot formed in the leg veins can dislodge and travel to the lungs, causing what we call a pulmonary embolism. Patients might describe this as, "I suddenly felt out of breath," or "I had a tightness in my chest." Such cases often lead to death due to respiratory failure. Similarly, clotting disorders can cause blockages in the arteries supplying the heart, resulting in a heart attack. Clotting disorders and bleeding problems. Cancer disrupts the body's clotting mechanisms, leading to blood vessel blockages. Not only tumors, but sometimes treatments themselves increase the risk of clotting. This can result in serious conditions like stroke, heart attack, or respiratory failure. In some cases, blood vessels become entirely blocked, either by clots or cancer cells, cutting off blood supply to vital organs. For instance, metastasized tumors can compress blood vessels in the area they invade, restricting blood flow and causing organ failure. On the other hand, tumors may invade blood vessels or organ surfaces, leading to uncontrolled bleeding. This is particularly common in cancers of the stomach, intestines, and lungs. Loss of vital organ function. Another impact of cancer is the loss of function in vital organs. For example, a brain tumor can increase intracranial pressure, rendering brain functions irreversibly impaired. It's worth noting that brain tumors are classified as benign, non-cancerous, or malignant, cancerous. However, all brain tumors are effectively considered dangerous because even benign tumors can increase intracranial pressure, compress the respiratory center, and disrupt breathing, leading to death. Lung tumors reduce oxygen distribution by occupying large portions or even the entirety of the lung, hindering oxygen exchange and causing respiratory issues. Similarly, cancers within the abdominal cavity can obstruct the intestines. This is a common cause of death in ovarian, colorectal, and gastric cancers. Metastasis can also block bile ducts or ureters, leading to complications like liver or kidney failure. These blockages may even result in infections like sepsis, which can progress to multi-organ failure. Infection risk. Even a simple flu infection can turn into a deadly lung infection in cancer patients, mainly because their immune systems are often weakened. Both cancer itself and treatments such as radiotherapy and chemotherapy suppress the immune system. A reduction in white blood cells, which fight infections, makes patients vulnerable to opportunistic infections. Pneumonia is one of the most common causes of death among cancer patients. During the COVID-19 pandemic, it became evident that cancer patients, especially those with blood cancers, are particularly vulnerable to infections. Treatment-related issues. Cancer treatments can also lead to life-threatening side effects. For example, chemotherapy or immunotherapy can trigger severe immune responses in the body, damaging healthy tissues and causing autoimmune diseases. Chemotherapy lowers white blood cell counts, increasing infection risks. It can also reduce platelet levels, leading to bleeding. Some treatments may cause heart rhythm disturbances or heart failure. Cachexia. Cachexia is a severe condition characterized by significant weight loss, muscle wasting, and general weakness, often seen in chronic illnesses like cancer. This condition involves not just fat loss, but also significant muscle loss, and is often life-threatening. Cachexia affects up to 80% of cancer patients and is estimated to account for about 20% of cancer-related deaths. Metabolic problems. Cancer deeply impacts the body's metabolism, disrupting many vital balances. For instance, certain types of cancer break down bone tissue, releasing excessive calcium into the bloodstream. High calcium levels can disrupt the electrical activity of the heart muscle, leading to fatal arrhythmias.